Hi, this is George Alger. Welcome to today's segment of Our Ventura TV. Today we're going to be speaking about non-drug pain management. And joining us is Dr. Laila Nayab-Murshidi. Welcome, Doctor. And let's start off with a brief statement about what non-drug pain management even means.
Hi there. Thank you so much for having me. I would say, just anything that allows your body to heal itself without introducing a pill to do that for you, or just a lot of times those are just reducing your symptoms, not really necessarily correcting the problem that you're having, just allowing your body to heal itself. There's so many different types of non-drug treatments, such as acupuncture, chiropractic, exercise therapy. There's so many different things that can be done. I can speak about chiropractic today since that's what I do.
Okay, very good. Well, let's take it from a viewer's perspective here. So, what is a realistic expectation for a viewer who is starting some kind of non-drug pain management plan, or in this case, chiropractic?
A realistic expectation would be to if if people are experiencing pain, then obviously it's because a nerve is pinched, and so usually you don't feel pain unless there's actually something going on. So of course, I believe it's absolutely crucial to get our regular physical exams and blood tests and all that on a regular, but as well, just allowing the body to heal itself. With chiropractic, we're looking for a vertebral subluxation, which is basically a spinal bone that's misaligned. So when a spinal bone is out of alignment, it narrows the space in which the nerve is passing through the spinal cord between the spinal bone to that particular organ, system, or cell, or tissue, or joint, muscle. And as a result, it starts to dysfunction. And a lot of times we don't even actually get pain, but by the time we actually get pain, it's already well advanced. So anything can be done to introduce motion to the spine, as far as to the muscle, and that can be through exercise, it could be through yoga, it could be through strengthening that muscle and creating mobility. But specifically, chiropractors mobilize that specific spinal bone that's subluxated and out of alignment to reduce the pressure on the nerve and allow the nerve to communicate better with that particular area. And as a result, you get instant relief of pain. Unless it's a chronic situation, and obviously that's going to take a little bit longer. And as a chiropractor, I don't just mobilize the spine, I also teach my patients how to be self-sufficient so that they can actually introduce some movement on their own at home with exercises, using a foam roller, working on the muscles, introducing heat, ice, a lot of variables like that that can help them.
Okay, so if a viewer has pain in, for instance, a muscle, or it seems like it's in a bone or something like that, or a spine, obviously that seems like something that a chiropractor could accommodate. But if they have, for instance, say, pain in their stomach, or a headache, is this something that chiropractic wouldn't be able to remedy?
Absolutely. Depending on where it's coming from, if it's a physiological situation, obviously we want to find out if it's something other than just a spinal misalignment. So a spinal misalignment can cause digestive issues, can cause headaches. So if we can mobilize those specific segments that correlate with head pain and with the digestive pain, then yes, that would be the first line of treatment to remove that nerve pressure, introduce better movement of that spinal bone, allowing that nerve to communicate better with those specific areas, allowing the pain to go away. But if it continues on, we want to find out, what is that cause? Is it something that they might be allergic to? Is it something that they're eating? Is it something that they're allergic to? Or it could be other variables. But initially, removing the subluxation, removing that pinched nerve, allowing better communication for that nerve to that particular site, can give instant results. But we do, as chiropractors, also look at nutrition. Somebody who's having a digestive issues could be and they're not producing enough acid. For example, they're deficient in acid. So hydrochloric acid enzymes could help them to digest food better, and other probiotics or stomach enzymes can really help and enhance their overall function in the digestive system, as well as for headaches, so that we can avoid medication.
Would it be fair to say that chiropractic is an overall holistic approach as opposed to just what someone might think has to do only with the bones?
Absolutely. I do have a lot of patients coming in here with headaches or with neck pain or back pain, but they don't realize that also their other areas start to respond as well. So I have patients coming in telling me that they have mid back pain, like right in the middle of their back. And we start adjusting them. They're like, oh, my stomach starts to feel better. I don't have that indigestion, heartburn, acid reflux anymore. And they're feeling like they don't have to resort to those medications, the anti-acid medications, because their digestive system improves in its function. And that goes along with all other organs and systems of the body producing symptoms that when they start to not function properly, and those areas start to feel better in those areas.
Okay, very good. And would chiropractic be something that can work in conjunction with a traditional medicine path, or they're typically different paths altogether?
100%. I have patients who have rheumatoid arthritis, and they take really harsh medications, and as a result, they're always feeling really not so good because the medications are harsh on the stomach, harsh on the body. So, but a lot of times they think that they're supposed to have those symptoms, and so they accept that and they take the medication. But when they realize when they come in that some of their symptoms is because of osteoarthritis, not just rheumatoid arthritis. So we help them by 70–80% reducing their pain, so then they're not having to resort to their medication as often.
Okay, and do you have any suggestions or advice or tips that someone could use on themselves for some type of non-drug pain management?
A tip would be to move. Everything is about motion, because my saying is motion is lotion, and that's so critical and important, because the reason why movement is so important is because when you move, your body gets blood circulation, and blood is food for your cells. Blood is nourishment. Blood is healing. And so when you move, you improve motion in that particular site that is lacking blood flow. And so when that area is not getting blood flow, just like if we don't eat, what would happen to us? We would atrophy, we would degenerate, we would perish. If there's lack of blood flow in that particular part of your body because of restriction, because of lack of motion, because we're sedentary, that area is not getting the nourishment. So that area starts to wither away by becoming atrophied. It starts to degenerate. And as soon as we introduce motion, whether we do an adjustment specifically to the spine, or we mobilize the muscle and introduce some deep muscle work, or stretch the patient, or they themselves exercise and walk and create some mobility, they're actually allowing nourishment and blood flow to reach those areas that are not getting the blood that they need to thrive and function. And otherwise it's just, we wonder why we're aging so fast in the spine. It's because we're not moving enough.
Wow, okay. We're just about out of time here. I wonder if you could have, mention the website, and then if there's a final message you'd like to convey to the viewers.
Absolutely. Thank you. It's Tustin, TUSTIN, VMC, Victor Mary Charlie.com. And I would say is just don't accept when you're labeled with a diagnosis, because sometimes those diagnoses could be wrong. I have great respect for the medical model, and the medical world, and they help us in many ways. But one thing is that they could get it wrong sometimes, and you have a diagnosis and you get labeled with, for example, rheumatoid arthritis. So then you accept that label and the symptoms that go with it. There's so much more that can be done to help you, and not just accept one diagnosis. When you have that diagnosis, then you accept all the symptoms that go with it, and that's not necessarily the case.
Thank you very much. We're going to end off here.
Of course.
This is George Alger signing off for this segment of Our Ventura TV until we meet again.